The CDC is taking a look into veterinarians' roles in preventing disease transmission, and the BLM is exploring options to balance a growing herd of wild horses and a shrinking budget. I'm Ryder, news editor of The Horse, your guide to equine healthcare. Welcome to the Ryder Report for July 9th. The CDC recently released a report showing that many veterinarians do not consistently engage in behaviors or practices thought to prevent the spread of diseases that are transmissible from animals to humans. A questionnaire was mailed to U.S. veterinarians regarding their perception of zoonotic disease risks and precaution awareness. More than 2,000 returned the completed questionnaire, including 456 equine practitioners. The study found that 72% of equine veterinarians reported not always washing their hands before eating, drinking, or smoking at work. Additionally, 82% of equine veterinarians reported not always washing their hands between patients. Equine vets were also the group most likely to recap needles, which is significantly associated with accidental needle sticks. The researchers will present further results along with recommendations on July 22nd at the upcoming AVMA convention. On the subject of zoonotic disease, 3 horses have tested positive for Hendra Virus at Redlands Veterinary Clinic on the outskirts of the city of Brisbane in the Australian state of Queensland. Hendra Virus is deadly and can affect both horses and humans. 2 of the horses died and 1 recovered fully. There are 37 horses remaining at the clinic, and a number of clinic staff members were exposed to these recent cases. This virus has only been reported in Australia. Fruit bats indigenous to the continent appear to be its natural host. For more information, do a search for keyword Hendra Virus on thehorse.com. The Bureau of Land Management made waves last week when they announced that it might consider euthanasia as a means to manage wild horse herds. A deputy director with the BLM presented the euthanasia option during the June 30th meeting of the Wild Horse and Burro Advisory Board, saying this could be one solution to cope with increasing herds and a shrinking budget. According to a BLM spokesman, there are currently 33,000 wild horses on the range, while an acceptable level would be 27,300. Meanwhile, 30,000 additional horses reside in long or short-term holding facilities depending on their age and adoption potential. Last year, the BLM spent $22 million of its $39 million budget on holding facilities. Next year's costs for maintaining the horses at holding facilities are projected to account for $26 million, while the group's budget is cut by $2 million. The agency might also change its adoption policy to counter sliding adoption numbers. A decision on the euthanasia option is expected in September. Meanwhile, the agency is soliciting public opinion on the issue on its website, www.blm.gov, and via phone at 1-800-710-7597. We'll close this week's edition of the Ryder Report with a happy news story of the week. This 4th of July marked the 1-year anniversary of Kentucky Derby winner Funnyside's last race. The champion gelding didn't rest on his laurels, though. Just 48 hours after crossing the finish line for the last time, Funnyside found himself employed in the same industry but with a different job title. He became a pony horse. Assistant trainer Robin Smullen said they decided to keep the champion in work on the track because they felt he enjoyed track life and wouldn't understand why he didn't have a job if he'd been sent into traditional retirement. Funnyside's pony job is not honorary. He works hard. He goes out with 6 or 7 sets of racehorses every training day. Smullen noted that Funnyside can read his equine pupils well and knows which youngster to be firm with and which to handle more gently. Whether jogging the track or standing patiently, Funnyside gets the job done. A year after winning his final race and retiring sound, it looks like Funnyside is getting the last laugh. That's it for this week's Ryder Report. Visit thehorse.com for all the latest news on equine healthcare, management, and welfare. I'm Ryder, news editor of The Horse, your guide to equine healthcare. Thanks for watching, and we'll see you next week.